This video presents a case conceptualization of post-traumatic stress disorder and moral injury in a combat veteran. We'll review the client's background, assessment results, and a treatment plan integrating art therapy. The U.S. Department of Veteran Affairs estimates 17 to 18 U.S. veterans die by suicide each day. Many of these veterans experience PTSD, depression, and moral injury, which are significant contributors to psychological distress. Meet Kat, a 45-year-old Marine Corps veteran with combat deployments to Iraq and Afghanistan. She lives alone in northern Michigan and has limited social support. She has been prescribed multiple medications for depression, anxiety, pain, sleep disruptions, and other health issues. In our first session, her statements reflected survivor guilt, emotional numbness, and risk-seeking behavior as an attempt to feel something again. Kat reports intrusive combat memories, survivor guilt related to loss of friends and fellow comrades, shame related to deaths caused during operations, suicide ideations, emotional numbness, and risk-seeking behaviors. These symptoms align with both PTSD and moral injury. Kat's symptoms interfere with daily functioning, causing her to avoid social gatherings, lose interest in hobbies she once loved, constant fatigue, and struggles with the ability to keep regular work hours. She also carries persistent feelings of being a burden, that she is never enough, and gets overly emotional when it comes to confrontation. Assessments performed by her primary caregiver confirm severe symptoms and assessment ratings. The PCLM, or Military Post-Traumatic Stress Disorder Checklist, indicated severe PTSD due to her recent intrusive memories of her time in combat, her tendencies to avoid social situations, feeling numb to things that used to make her happy, and always feeling on guard. Her depression assessment, PHQ-9, showed indications of severe depression that is causing her the inability to sleep consistent hours and feeling of hopelessness most days. Kat's suicide risk scale reflects high suicidal ideations because of her perceived burden and suicidal thoughts. And the moral injury and distress scale, MIDS, showed significant impairing distress due to personal transgression, her experience witnessing immoral acts, and feeling betrayed by her leadership. Art therapy is highly effective for trauma survivors. It aids in externalizing memories, assessing nonverbal emotional expression, and supporting meaning-making, especially when trauma is hard to verbalize. The first art therapy directive was mask making. This allowed Kat to explore the difference between her public identity and her hidden emotional experiences, capturing her internal struggles without the need for words. Next, body mapping helped Kat identify and therapeutically express what she was physically experiencing throughout her body through art. The third directive, identity reconstruction, was introduced to help Kat rebuild a sense of herself after leaving the military service. Treatment goals for Kat focused on using the creative process to reduce PTSD symptoms and suicidal ideation, process moral injury, and restore Kat's identity and purpose. Art is a powerful tool for healing and can help in many ways that common talk therapy cannot. After 6 months of integrated art and trauma therapy, Kat shows meaningful improvement. Her PCLM score dropped from 69 to 46, showing a significant reduction in PTSD symptom severity. Her PHQ-9 from 21 to 11 shows a decrease in depression from severe to moderate. To put this in perspective, a change of 5 or more over time is considered significant improvement. Finally, her Beck scale, in regards to suicide, dropped from 23 to 8, moving her from high risk to low risk. Although all of these scores dropped, they are still notable, and it is recommended that she continue with further assessment to gauge her progress. In conclusion, many veterans struggle with guilt rather than fear. Healing requires witnessing, meaning-making, and self-forgiveness. Making note that addressing moral injury is essential for long-term recovery. If you or someone you know needs support, reach out now to the 988 Suicide and Crisis Lifeline, available 24/7. Remember, your experiences don't define you, it's how you move forward and grow.